As we continue to track the number of COVID-19 cases linked to the White House, one big question is, how did the testing policies go wrong? Marcelino Benito connects the dots.
As the White House continues to battle COVID-19, how and when they tested visitors is coming under scrutiny. Let's connect the dots. Early in this pandemic, the White House announced they were using rapid coronavirus tests to make sure people who came into contact with the president weren't infected. Experts point to several problems with that strategy, but the big one is relying just on testing is not enough. According to infectious disease experts, you might get a negative test result even if you do have COVID-19 because the virus is still building up in your body. That's why they recommend not just testing, but also masks and social distancing. Another problem is the test the White House used. The Abbott rapid tests are intended for people with coronavirus symptoms. In fact, the data submitted to the FDA as part of the approval process only shows how well the tests work on symptomatic patients. In that instance, the tests work pretty well, with a 95% accuracy rate. It is less clear how well they do on healthy people or asymptomatic patients. The regular testing may have also provided a false sense of security, leading staffers and those close to the president to take more risks. And health officials fear that may still be happening. That's because even with the negative test results, the CDC recommends quarantining for 14 days after being exposed to an infected person. Connecting the dots, I'm Marcelino Benito for H-Town Rush.